Margaret has been here a few times before, and she's keeping us updated on Marin General Hospital. And we're going to continue. We have 2 seats, I think, available, or 2 seats open for the election in November on the Healthcare District Board. So what do voters look for if they want to choose wisely on the candidates? What are the issues out there?
The Healthcare District is a policy-making board. It's not a management team. And you look for people who understand the role of elected officials in setting policy and are able to separate themselves from trying to run the district themselves. And there's an enormous temptation when you get elected to think you know more than those professional management people, and you will tell them what to do. That makes for a very dysfunctional situation, which is what we have been living with for the last 10 years, that the audience tells the board what to do, and the board tells the staff what to do, and so on. It's an awkward situation. So you have to look for people with enough experience to understand their role. They are not running the hospital. A hospital is not a hotel. If most of your experience in life is going to a hotel, you get a nice room, you get a good shower and a good night's sleep, and it costs exactly what you said you'd pay when you came in. Okay. A hospital, every room has a patient with a whole range of different problems. They can't predict when you come in what it's going to cost when you go out. They have to be there. They have to have full staff 24/7, 365 days a year. You can't plan hotels in the way you plan hospitals. Hospitals are more expensive for a reason. They're a more complicated thing. So anybody who thinks they're going to sit on the board and make hotel-type decisions on a very expensive, very complicated situation like a hospital, that's not the way it's done. Well, one of the things that came out at the Everest meeting that I attended was one of the worst decisions financially that the healthcare district made in recent years came as a response to community, or a few people in the community, who demanded neurosurgeons in the hospital 365 days a year, so that if an ambulance came, they always had a neurosurgeon there. And this means they have to have a trained nurse who is experienced in emergency neurosurgery, and an operating room available, and a bed in the hospital for those people to go to. The problem is that as it has evolved, nobody knows the exact numbers of having neurosurgeons on site all the time. But what they do know is there are something in the range of a dozen patients needing this level of service.
In a year?
In a year.
Yeah.
One a month. But it doesn't even come always on the 15th of the month that you could plan for. It could be any time.
6 in February and none, yes.
Exactly. Well, the problem is that's incredibly expensive to have those people there with their hands folded doing nothing. Okay, the board forced that decision on management without knowing the downstream effects of that. You diminish the services available to everybody else to come up with millions and millions of dollars to pay for what one group wanted. And what you do is charge everybody who comes into the trauma center more to cover the costs of neurosurgery for one patient a month on average. It's very easy with community pressure to respond even in irresponsible ways. And the reason the district board could do this is they had no responsibility for the budget of running the hospital. Now they're going to have responsibility, and they can't just satisfy this interest and that interest and so forth. You've got to run a hospital in the black. And so that's what they are taking on.
So it's not necessarily hospital administration that you want as a background. You want someone who understands the complexity of it maybe, but also understands the role of a board member.
Okay.
Is that the message? Or?
Exactly, that's the message. But if you've ever watched ER, ER is all drama. There are all kinds of patients coming in with all kinds of problems. Nobody on the program takes out 10 minutes to say, the cost of providing this service is X number of dollars. This person's insurance will cover Y number of dollars, etc. The drama is in the treatment of the patients. There's never a segment on ER where there are people in little offices in front of computers saying things like, well, here's what's coming up for Marin General. No matter what, their costs of keeping the lights on and keeping that building heated are just like all other energy prices are going to double in the next year. What other part of the hospital do we take this out of? You can't run an ER. You can't run the drama unless you have the plodding tortoise going along every single day, paying the bills, collecting the bills, balancing this interest against that interest. It's a very difficult task. So what you want is a board member who understands how to support the essential underlying processes of the hospital.